Hello pharmacists. Welcome to Learn with Pharmy. Do you usually ask a walk-in female customer if they are pregnant in a retail pharmacy setting who wants to purchase ibuprofen tablets over the counter or OTC? Let us review the use of ibuprofen in pregnancy. It is a very important question, and the use of ibuprofen in pregnancy depends on which trimester the person is in, while the general rule says avoid ibuprofen as much as possible during pregnancy unless specifically prescribed by a doctor. Let's break it down carefully. In the first trimester, which is 0 to 13 weeks, there are possible risks of miscarriage and heart defects when taken regularly or in high doses. Occasional use may be allowed under strict medical supervision, but it's generally avoided unless absolutely necessary. In the second trimester, which is 14 to 27 weeks, short-term, low-dose use may be considered if benefits outweigh risks criteria, but still, doctors prefer other options. While in the third trimester, which is from 28 weeks onwards, ibuprofen is contraindicated or should not be used. 1. It can cause premature closure of the ductus arteriosus. FYI, Pharmacist's ductus arteriosus is a vital fetal blood vessel. It is a temporary blood vessel in the fetus that connects the pulmonary artery, which normally goes to the lungs, to the aorta, which goes to the rest of the body. In the womb, the baby doesn't use its lungs for oxygen. The oxygen comes from the placenta via the umbilical cord. So the ductus arteriosus bypasses blood away from the lungs, sending it directly to the body. It also helps the fetal circulation function efficiently without breathing air. That's why ibuprofen, and other NSAIDs like diclofenac, are contraindicated in the third trimester as it disrupts the fetal circulation. Blood is forced through the lungs too early, causing pulmonary hypertension in the fetus, newborn, which then leads to heart failure and fetal distress. 2. It also may lead to fetal kidney problems by reduced amniotic fluid, which is called oligohydramnios. 3. Increases the risk of complications during delivery, example, prolonged labor, bleeding. So in conclusion, paracetamol or acetaminophen is the preferred choice throughout pregnancy when used at recommended doses. Well, pharmacists, do ask that safety question to make our patients aware of the side effects. So wishing you all the best in applying these insights. Please feel free to ask your questions or provide suggestions in the comments section. Happy learning. Thank you from Pharmy.